This recorded lecture will be going over Chapter 34, Administering Oral, Topical, and Inhalant Medications in the Fundamentals textbook. Medication errors can occur at any step in patient care. Medication errors are most common at the ordering or prescribing stage, and they make up almost 50% of medication errors. Nurses are legally responsible for being knowledgeable about each medication they administer to patients, including the correct dose, the route by which it should be given, desired effects, side effects, interactions with other medications, and any contraindications. Assessment of the patient after medication administration will provide data for evaluating the medication's effectiveness and guiding patient education. In accordance with national patient safety goals, patients and families should be involved, educated, and provided with written information on the medications the patient should be taking when they leave an organization's care. All procedures related to medication administration should be followed exactly to promote safety and avoid making a medication error. Should an error be made, report it promptly in accordance with agency policy and take appropriate action to promote safety and well-being. Medication orders that are unclear, incomplete, or ambiguous should be questioned to avoid any errors. Questioning a physician's or other healthcare provider's order when you are uncertain about it is vital in protecting a patient's well-being. The 6 rights of medication administration provide a framework for safe delivery of drugs to patients. Practice in the clinical setting will help establish a consistent, efficient routine for giving drugs. A written prescription for a drug is called the medication order or the drug order. A complete drug order needs to include a patient's full name, the name of the drug, the dosage to be given, the route of administration, how often it is to be given, the date and time written, and the prescriber's signature. In your practice, you will encounter several types of medication orders. A routine or scheduled medication order is carried out until it is canceled by the healthcare provider or until the prescribed number of doses has been given. A PRN order is written to treat specific symptoms experienced by the patient on an as-needed basis. Some PRN medication orders will specify when or how the medication can be given. A one-time or single order is written for a drug to be given once. A STAT order is an immediate order, and the nurse should administer the medication within 15 minutes of the order being written. The primary care provider must give or write a renewal order to continue certain medications. Opiates, sedatives, antibiotics are all examples of medications that would require a renewal order. At the end of a specified period, the order is no longer valid, and if no additional orders of the drug can be given without a new order. Orders by protocol can exist in specialty units, such as the emergency department, labor and delivery, or intensive care units. These protocols are in place for experienced nurses who are capable of interpreting findings, making accurate assessments, and using clinical judgment to treat according to a protocol. Checking calculations for a divided dose with another colleague is recommended at all times for a medication safety measure. Be sure to see on page 661 in table 34.3 abbreviations and symbols used in medication orders. And it would be important to pay attention to microgram, MCG, and PRN or PRN is as needed. The selected route of administration depends on several factors: the patient's condition, the nature of the drug, and the rate of absorption in one route versus another. The oral route is the simplest, most convenient, and least expensive route, also known as PO route. Some pills simply cannot be crushed because it will change their effect on the body. We know that there are 3 categories of medications that should never be crushed or cut: time-released, enteric-coated, and sublingual. Topical medications are instilled in the form of eye drops or ear drops or applied as ointments, pastes, or lotions to the skin or mucous membranes. The rectal route is often used to give medications to children or for patients who are vomiting. The use of technology has contributed to an increase in medication safety. Systems such as computerized provider order entry or CPOE, barcoding, and smartphones, mobile devices, personal digital assistants are a few examples of technology being used by healthcare providers today. CPOE significantly decreases the potential for transcription orders, one of the many causes of medication errors. Other features of the CPOE system include alerts about adverse reactions, drug and food incompatibilities, nursing implications for administration, and updates on new drug information. Over the past 13 years, the number of hospitals that use paper-only patient health records have declined from 69% to 1%. When the barcode scanning is used properly, it decreases the likelihood of administering the wrong drug to the wrong patient. When combined with the use of CPOE, nurses are able to perform treatments and administer medications in a timelier manner. The use of mobile devices, smartphones, and PDAs benefit the nurse as well as the patients. The medication administration record, or MAR, is part of the patient's medical record that the nurse will refer to whenever administering medications to a patient. If a CPOE is used, the medication order is transcribed automatically into the EMAR. Nurses and students should never rely on a hard copy of the MAR that was printed out at the beginning of the shift, as the information contained on it can change at any time. There are three types of medication administration systems: the stock supply of medications, the individual prescription system, and the unit dose method. The advantages of the unit dose system and the individual prescription system have made the stock supply system less popular. The fixed site is generally in a small medication room that contains an automated dispensing machine, such as a Pyxis, individualized patient drawers, and medication administration supplies that are easily accessible for the nurse. Unit dose refers to drugs packaged in single individual doses. The unit dose system provides a pre-measured, pre-packaged, and pre-labeled dose of a medication for each patient. This system is considered the safest. If 3 or more unit dose packages are required to achieve the dose, recheck the order and your calculations. The unit dose system will also save time for the nurse. The prescription system is similar to the unit dose system, except that the pharmacy supplies enough doses for several days. A controlled dispensing system is used for distributing opiate analgesics, and hypnotics. Legally controlled substances must be locked away safely at all times. A significant advantage of this type of system is that a username and password or biometric identification system, such as a fingerprint, is used to enter the system. Each nurse has a username and password for gaining entry into the system. Biometric identification ensures that unauthorized users cannot gain access. Once the nurse removes the controlled substance, they are required to count the remaining medications left in the drawer or cabinet. This count needs to match the computer count. If there is a discrepancy, the nurse must determine how that error occurred. As soon as the medication has been dispensed, verify the label on the drug dispenser with the patient's medication record. Regardless of whether the drugs are counted manually or by a computer, each dose of a controlled substance must be accounted for, and the number remaining verified at the time of shift change. One nurse from the oncoming shift and one nurse from the shift going off duty should do the count together. Any discrepancy must be resolved before the nurses on the ending shift can leave the unit. Topical drugs are applied externally to the skin and mucous membranes. Drug solutions instilled in the eye, the ear, and the nose are topical and act locally on these tissues, but they can also have a systemic effect on the patient. Ointments are medicines manufactured in an oily base, such as petrolatum or lanolin, which keeps the drug in a prolonged contact with the skin surface to obtain a soothing and anti-inflammatory effect. Paste will have a stiffer consistency than ointments will, and they do not melt at body temperature. Lotions and liniments are topical drugs in liquid forms, such as calamine lotion. Lotions are patted on gently, whereas liniments are rubbed into the skin. Suppositories are small, cylinder-shaped, semi-solid substances that are inserted into body orifices, such as the rectum, the vagina, the urethra, or an ostomy stoma. Suppositories contain medication that is absorbed through mucous membranes. The first thing to do is check the order for each medication. Check the patient's record for any allergies, and first figure out why you're giving the patient that drug. Assess what the patient knows about their medications and define any learning needs. When topical medications are to be applied, assess for any adverse effects, such as inflammation, swelling, redness, or discharge. See the lifespan considerations on page 666 in the green box. Assess your patient's manual dexterity. If your patient seems shaky or has trouble with fine motor movements, take a clean towel and spread it across their chest before handing over their pills or tablets. If the patient or you drops the pill on the clean towel, it can be retrieved. But if the pill falls on the floor or on dirty linens, you need to obtain a new pill from the pharmacy. By looking at the medications that a patient is receiving that are unrelated to a primary condition for which they're hospitalized, you can easily uncover and address any chronic conditions that the patient may have. Digoxin is given to increase contractility of the heart. Plan and incorporate times for medication administration into the daily shift work schedule. A grid on the daily worksheet for assigned patients and the times of their medications can be useful. Plan to assess for side effects of the medication before giving the next scheduled dose. The overall goals of medication administration include that medications are given safely to each patient on time, that any serious side effects will be identified quickly, the medication will be effective, and no allergic reaction will occur. The patient will understand why they're getting the drug, the adherence to their drug schedule, and will know to report any serious side effects. It's important to assess the apical pulse before digoxin administration. When preparing any medication, remember to check the label 3 times and follow the 6 rights of medication administration. Patient education is an integral part of medication administration. Oral drugs can be supplied in many different forms. Occasionally, you will have to cut a tablet in half to achieve the correct dose. When this needs to happen, use a tablet splitter or pill cutter for this purpose. When giving a drug in a tablet or capsule form, be certain to offer sufficient water with which to swallow the medication. And remember that any water that is used needs to be entered on the intake sheet if the patient is on any intake and output recording. See the lifespan considerations on page 669. If an older adult patient has difficulty swallowing a pill, instruct them to take a sip of water and swallow it. Then place the pill towards the back of the tongue. Have the patient take a large sip of water, place the tongue on the roof of the mouth, and with the chin slightly downward, swallow with more water. Consider crushing or cutting a pill unless contraindicated, or consider asking the provider for a liquid form of the drug. When preparing liquid medications, pour the dose into a graduated medicine cup. Sublingual medications should be placed under the tongue. They should never be swallowed. The drug will dissolve in the sublingual pocket and is quickly absorbed by vessels in the oral mucosa. Swallowing these medications will alter their absorption and can make them ineffective. Ophthalmic or eye medications can be in the form of drops, ointment, or an eye disc. Eye medications need to be kept sterile. Careful hand hygiene is necessary before beginning the procedure. Some medications can stain the lenses, so contact lenses should be removed. Ointments can coat and destroy them. Otic or ear medication is primarily used in children to decrease the pain of otitis media, but it can also be used to treat external otitis and soften cerumen. For the child younger than 3 years, pull the earlobe downward to straighten the canal. For the adult, pull the top of the pinna out and up. Nasal medications come in a soft plastic atomizer or dropper bottle. An atomizer bottle will contain decongestant. To use an atomizer bottle, have the patient clear the nose as much as possible. While holding one nostril shut, the patient inserts the top of the atomizer into the other nostril. The patient squeezes the bottle while breathing in and repeats the process on the other side. 1 or 2 squirts per nostril is the usual dose. The top of the bottle should be wiped clean before the cap is replaced. Inhalation therapy is used for patients with respiratory conditions, which can originate in any area from the nasal passageways to the deep lung tissues. Various mechanical devices, such as atomizers, sprays, and handheld metered-dose inhalers, are designed for aerosol treatment. Metered-dose inhalers, or MDIs, and nasal sprays come in containers labeled with their directions for use. Using a spacer with the device will enhance delivery of the medication deeper into the bronchioles. Patients do need to be taught how to use an MDI properly. On page 676 in the blue patient education box, you can see some instructions on how to use a metered dose inhaler with a spacer. Using a spacer with a metered dose inhaler is the preferred method, so instruct the patient to use the following steps. Place the mouthpiece of the chamber in the mouth between the teeth and seal the lips around it. Completely exhale from the nose. Breathe in slowly. If you hear a horn-like sound while inhaling, slow down your inhalation. After inhalation, hold the breath for 10 seconds and try not to cough. This allows the medication to penetrate the lung mucosa. Exhale through the nose and take 2 or 3 short breaths to open the remaining medication in the spacer. A vaginal irrigation is also called a douche. Topical solution is introduced into the vaginal cavity for the following purposes: to cleanse the vagina in preparation for surgery, to supply antiseptics to reduce bacterial growth, to remove odors or foul discharge, to apply heat or cold to soothe inflamed tissues or reduce the oozing of blood. Vaginal irrigations are considered a clean procedure, except when given after surgery or childbirth. Then the principles of surgical asepsis need to be followed. The patient should receive instruction in the correct way to perform the irrigation. Other topical medications applied to the vagina are suppositories, ointments, and creams prescribed to treat infections and inflammation. Applicators are used for inserting the smaller vaginal suppositories at the distal end of the vagina. After medication has been inserted, a small pad or panty shield can be worn to keep from soiling clothing or bedding. Rectal medications are dispensed in the form of suppositories. Many types of topical medications, including lotions, ointments, creams, and patches, can be applied to the skin. Transdermal or through the skin medications are supplied in a sustained release patch that is applied to clean, dry, hairless skin and left in place, or as a paste that is spread on a small area of skin. Skin patches should be applied to areas where there is adequate circulation, such as the chest, shoulders, or upper arm. Hair should be removed before applying a patch. The effect of the medication from a skin patch will begin in about 30 minutes and can remain in the system for 30 minutes after the patch has been removed. The patch should be dated, timed, and initialed so that it is evident when it was applied. Before placing a new patch, be sure that the old one has been removed. On page 680 in the red safety alert box, see the dangers of topical medications. Because topical medications are applied externally, many people do not view them as medicine. However, this can be a deadly mistake. Serious adverse reactions and even deaths have been reported following topical medication administration. Chemical burns have occurred following the use of products containing methyl, methyl salicylate, or capsaicin. One 17-year-old cross-country runner died after using too much cream-containing methyl salicylate for muscle pain, which was absorbed systemically. Topical anesthetics used before cosmetic procedures have also resulted in patients dying. Topical steroids can also come in various strengths. Be vigilant and carefully check the dosage before you apply the medication, and always assess the skin for any old patches before applying a new one. Nitroglycerin can be dispensed as a paste. When it is dispensed and ordered as a paste, the paper should be placed paste side down on a clean, hairless area of skin and then taped into place. Be sure to write the date and time on the paper. Always rotate your sites to avoid any skin irritation. When one applicator is removed, it's important to cleanse the skin and apply the next applicator in a different, clean area. Many oral medications can be given through a feeding tube. It is best to use liquid medications to prevent clogging of the feeding tube, but not all medications are available in a liquid form. The contents should then be dissolved in water and administered through a feeding tube. Medications that should not be crushed and administered through the tube include sublingual, buccal, enteric-coated, sustained release, or potentially carcinogenic products. Always be sure to check with the pharmacy before crushing any medications. Do not mix the medication with a tube feeding because many things can interrupt the delivery of the entire dose of the medication. Evaluate for any therapeutic effectiveness or signs of adverse effects before administration of your next dose. Documentation of medication administration is largely done on the EMR. Data that needs to be documented includes the medication name, dosage, route, and time administered, blood pressure and pulse before administration of antihypertensive and beta blocker drugs, the reason for administering a PRN medication, and assessment data regarding side effects of any medication, patient education regarding the medication, and any evaluation data indicative of medication effectiveness. It is estimated that 1 to 2% of hospitalized patients are harmed from medication errors. All medication errors must be reported as soon as they are discovered, regardless of whether the patient was harmed or injured. After notifying the provider, carry out orders to safeguard the patient. The nurse who discovers the error is the one who reports the error and fills out the report. The Joint Commission will require that a process called a root cause analysis be used to investigate a sentinel event. This is an occurrence that causes a patient a death or serious injury. The purpose of the root cause analysis is to help the healthcare system understand why this event occurred and prevent strategies to prevent anything from happening like that in the future again.